So what is detox and how can it be applied in an addiction recovery center? Well, detox to me is basically cleaning up habits. So much of our health is related to how we live our lives, and the habits is simple, is what I call the snacks, S-N-A-C-C, sugar, nicotine, alcohol, caffeine, chemicals, which is, all drugs basically. Creates toxicity and inflammation and a lot of problems in the body. Taking breaks from these, to me, what's key in health is understanding our relationship to whatever substances we enjoy, which is, everybody's got, something, and some people have several. And, but detox is basically taking a break from those things and supporting the body's detoxification systems. Liver, digestive tract, exercise and sweating, and lowering the toxins going in. So, supporting the body nutritionally while we're lessening the toxins going in allows the body a bit of a break, and oftentimes people feel better. They have less inflammation, they sleep better, their head's clearer, and a lot of things change. I mean, to me, I've often been quoted as saying, detoxification is the missing link in Western nutrition. And we need to take breaks from things. When we get habituated, we can become addicted to even simple things like sugar and caffeine, besides heavy drugs. So the lifestyle aspect of addiction and recovery is really crucial. Do I have any advice on mindfulness, meditation, and general overall approach? And it's important. I think one of the keys that we all need to do to make change, because that's really, as a family doctor, I'm always looking at how do I motivate this person to take care of themselves better. And when I started working on my own health back 30, 40 years ago, I said, wow, I have to realize this one attitude. So looking at the underlying attitude to me is crucial. The attitude that we all could embrace would help us is, wow, this is the only body I have. I have to treat it with love. When I state that, and then I'm going to start feeding myself better, I'm going to take breaks from things that might be undermining my health, I'm going to exercise, I'm going to make sure I get sleep, I'm going to learn to manage stress and deal with issues, and kind of coming to supporting the richer inner self, our inner being, is a beginning, and meditation helps to do that. It just helps quiet the mind and says, what am I feeling? So to me, connecting with the feelings and our instincts, and if we could say even our spirituality is important, and embracing this higher level. How can I do good for myself? How can I do good for the world? I mean, that's, how can we be better people? We all can evolve in that way. And so I think the inner exercises, even doing yoga and things like that, are all helpful at tuning into the body and helping us, become more complete human beings, basically. Well, I think if my approach, if adopted by teens, might improve or reduce drug dependency. I do. I think if teens, because self-image is really so important to teenagers, and actually I as a preventive medicine doc, I want to reach out to young children, because learning how to take care of this body as early as possible is going to prevent things. So we need to reach 4 to 8-year-olds with what does it take to keep a body healthy. When we're younger, we feel almost immortal, like we can get away with anything. But we don't realize, and even earlier now, by the time we hit 30, we're paying the consequences of some of the habits that we develop. I think it's important in the new edition of my book, The Detox Diet, I have a chapter called Teenagers and Detox. So looking at some of the symptoms we have and saying, what do these come from? Why do I have, my skin, my skin's bad, I'm not sleeping well, my digestion's up, I get headaches, These are a result of habits. They can be foods, they can be food reactions. So I have this whole chapter dedicated to looking at elimination diets and developing, a positive attitude toward health, is important at all ages, but, teenagers tend to resist, any kind of authority or the ideas that they have to maybe do anything to improve themselves. And I think that's part of the key message, that we're all, our parents are, we don't want our parents running our lives so much, so we have to take care of ourselves. And that's how we can demonstrate, our own independence and create our own health. What do I think is wrong with the medical model? Well, it's not based on health and education. It's based on naming disease and giving it pills. I call it the attack and conquer approach. And my whole practice has been on prevention and living life healthfully in order to create health and vitality. And when we look at health, it's not just the absence of disease, it's really feeling good, being vital, enjoying life, living life more fully. So I think the medical model is too crisis-oriented, and it's not really based on prevention and keeping people alive. And I think one of my messages is that doctors need to come back to their original calling. The word in Latin means to teach. And so having educational support, having lifestyle counselors in all, mainstream or primary care practices, so that, well, I don't know how to eat better to improve my health or lower my cholesterol. I mean, yes, we send people to nutritionists, but somebody in the office that can support them. How do I get you motivated to do an exercise program? So this hands-on approach in healthcare, I think, is needed, and it's too much based on doctors who deal with crisis day in and day out. They're stressed. The patients are stressed. It's not a good way. I enjoy my practice because I help people evolve and make and change and actually go from the beginning of pre-diabetes and early diabetes and high blood pressure and high cholesterol and the beginning of cardiovascular disease. We can reverse that to a certain degree or delay it at least. Even if we have the potential, everybody in our family has diabetes, we can still reduce our risk or delay its onset. And that can save billions of dollars in healthcare. And so the focus on prevention, it's happening now, but we need to build in, we also need to build in more financial incentives and penalties for people who don't take care of themselves and use and abuse the healthcare system. There's too much of a mindset in our culture that I can do whatever I want. I have freedom here. This is the US of A, I can do whatever I want. The system will save me when I need that. But they don't realize that they're the ones who will suffer ultimately, and the system doesn't really save them. But it will care for them. But we need to come back to, this is my only body I have to take care of it.